Welcome to Pregnant After 40 Diaries. Today I'm talking about advanced maternal age, what actually it means, and to let you know that it is not a verdict, because sometimes the phrase feels like a diagnosis, but it's not. Here are what the medical labels really tells you, and the much larger story it leaves out. The much larger story it leaves out, I will tell you first of all, is that you are an individual with your own story, not a general statistics that is a summary of a time that is not now and a place that is not here. That is what it is. Okay, so if you have received paperwork with that label, advanced maternal age printed on it, perhaps you went for a routine checkup, a prenatal visit, and you just felt like, I'm old, I'm too old to be pregnant. That is not true. It's just a clinical, bureaucratic way of categorizing women and their stage and age of pregnancy. But you'll be pleased to find out that 1 out of 4 women usually give birth in their 30s, and 35% of women, that is by 2025 statistics, give birth from 30s, 35 and above. And 80% of babies born to pregnancies over 35 years old result in healthy births. So 80% is an overwhelming number. That is to let you know that it is not a verdict, it is just a statistics. So where did the label come from? The label actually came from the 70s, due to that was a gold standard as at then. And again, society at that time, 35 seemed old in quotes, to have a baby. And researchers needed to decide what the statistical risks of chromosomal abnormality, what it was. So at age 35, it was like the danger of abnormal chronological disorder, was higher or more predominant, or the risk was more obvious. That was the research as at in the 1970s. But guess what? This is 2026, and that necessarily is not the reality. All right, the cutoff was never meant to define what or who has a good pregnancy and who doesn't. It was just for administrative purpose. And guess what? It is something that a lot of people, a lot of doctors have still work with. But for you as the patient, it is not the end. It is not the be all and end all. That's what I want you to take away from this conversation, that it is just a bureaucratic process. It is just a statistics, but not your reality. So what the abnormalities that were studied then was for Down syndrome, the risk of Down syndrome, the risk of gestational diabetes, the risk of having a healthy live birth, and then any chronological dysfunction, which to this day, the risk of gestational diabetes is a reality for women over 40, for women 35 and above. The risk of hypertension is a reality for women 35, 40 and above, that are pregnant. It's a reality, but it's not something that cannot be managed, because with tests, going for your antenatal tests, antenatal visits, doing your tests, you find out that you can be able to, a large extent, with your visits and the results of the test, manage your health, especially your hypertension, your blood pressure, because your doctor would prescribe, or your health provider would prescribe necessary medication that will help regulate your blood pressure. And it is very important in pregnancy, because a high blood pressure affects your baby. It affects your kidney. Just some months ago, that was like last month, March. Yeah, that was March. A young lady in her mid-30s she died because of kidney failure as a result of high blood pressure in pregnancy, and that was her fourth pregnancy. So it's not a function of if it's my first pregnancy or my second pregnancy or my third or whatever the number. Each pregnancy comes with its uniqueness and challenge, and so care should be taken as per the pregnancy itself, not the history of the pregnancy. The history of the pregnancy comes to play if you want to know the pattern of pregnancy. But for the peculiarity of a pregnancy, attention should be given to running the test for gestational diabetes, for blood sugar, to know your blood sugar, because that is what you used to know if you have gestational diabetes or not, and then high blood pressure. So things that actually matter more than age, okay? Research increasingly shows the baseline of health, access to quality prenatal care, and lifestyle factor are at least predictive of pregnancy outcomes as age alone. So your lifestyle, your prenatal care, the quality of your prenatal care determines to a large extent the outcome of your pregnancy. So it's not based on age alone. Okay, so things like your cardiovascular health, again talking about high blood pressure, your metabolic markers are strong predictors of gestational complication independent of age. Do you get it? Do you understand it now? So your cardiovascular health is not a function of age, it's a function of lifestyle. Early and consistent prenatal care, very, very important. You are 35 and above, please make sure that you register in a reputable hospital on time. Once you find out you're pregnant, register in a reputable hospital. Your appointments with your doctor, please don't joke with them. Know your body, know what triggers you, and be able to manage it, okay? Because it is very important. Early and consistent prenatal care. Then, if in a case of you've had, previous pregnancies, those histories are very important so that the doctor can track if you've had any challenge before. Like when you go to the hospital for the first time, or for your first visit or your second visit, or you're meeting a different doctor, they would always ask you some certain questions like, have you been pregnant before? How many children have you had? How many pregnancies were successful? Your family history. Does any member of your family have diabetes, especially your mom? Okay, these are important questions that can help them give an informed decision on what concerns you based on the results from whatever they ask you for. Then another thing is having a team that treats you as an individual. A team, a support group that treats you as an individual. These are things that helps every woman, irrespective of age, but especially in this our advanced maternal age, to be able to blossom. Because if you have a team that treats you like an individual, not a statistics, what happens is that, using myself as an example, is that attention is given to me as an individual, as a 43-year-old woman, 6 months pregnant, soon to be 44. Attention is given to me to ask questions that concerns me, not based on, because statistics said that women at the age of 43 are supposed to have high blood pressure, and so your blood pressure follows the statistics. No, they treat you as an individual, meaning you have, for example, you have high blood pressure, or you have sensitive nipples. They're able to talk to you, make you understand why you have sensitive nipples as against the woman that has swollen feet. Okay, so that's literally on the surface what I mean. All right, so reframing a conversation with your provider, very important. You are entitled to ask your provider to explain any risk in absolute terms, not just relative ones. In absolute terms, in layman English, without medical jargon, medical brouhaha. State it the way you would explain to a child to understand, because it is very necessary that you know the risk involved. But guess what? The risk can be managed. Then you're also entitled to being monitored. Why? I use myself as an example. There are sometimes I go to the hospital and my blood pressure jumps to 130 over 8, no, jumps to 140 over 90, and then after some time, maybe about 2 hours later, it could come down to 130 over 80. Okay, so that's the range it goes, I'm always at. So anytime I go to the hospital to visit my antenatal, that is something that is always monitored. So ensure that my blood pressure does not exceed 130 over 80 for my own safety and the safety of my unborn child. So being watched closely isn't the same as being in danger. That's one thing you should take away. It is a system working exactly as it should for you. Why? Because millions of people have healthy pregnancies and healthy babies at 35, at 40 and beyond. The label is the filing system, the filing system. It's not a forecast, it's a statistics. And your story hasn't been written yet. So, with this, I want you to arm yourself, arm your mind, and know that pregnant at 35, pregnant at 40, pregnant at 44, pregnant at 48, it's not a danger. It's not a write-off. It's not something you should be scared of. It's just something that is a successful period, a wonderful period of your life that you should enjoy and manage all the risk that could come with it. Now, if you enjoy this, I have an ebook called My Season Has Not Passed for the woman over 40 who still believes, and a journal that is called My Miracle in Progress. It's a 90-day tracker for you to track the 90-day preconception window where you study your body, okay, to know what works and what doesn't work to help in the process of conception. And then when conception happens, there is a week by week record for you and lots more. So check out the link in the description if you would want a copy. Now, if you also found this interesting, please share your comments, share your thoughts. That would be highly appreciated. And also, if you have a woman in this time of her life, do share this content with her, and I'll see you in the next episode. Thank you.